If healthcare were a gas station, industry experts say we might take time to shop around instead of paying the exorbitant price right in front of our face. Brenda Gleason is a healthcare futurist with decades of industry experience. Her consulting firm, M2 Healthcare Consulting, tries to predict where healthcare is headed and says Colorado is fighting the good fight. There are fewer roadblocks for low-income patients and upcoming legislation for transparent insurance pricing. But those remedies don't cure the system. We talked with Gleason about the state of healthcare in Colorado, the biggest concerns for patients of all ages, and why she's convinced the system is not broken beyond repair, it just needs some serious TLC. Phil Linden and Krystal 93 News Director, and I'm on the phone today with Brenda Gleason of M2 Healthcare Consulting. They've got offices in DC and Denver, and they've been at it for about 13 years. Brenda, thanks for making time to get on the phone today.
Thanks for having me.
Of course. And we met at a healthcare panel that was held right here in Frisco. It had all sorts of people, policymakers and politicians and yourself. Now, tell me a little bit about what a healthcare futurist is. That's how you were introduced at the panel. What do you do in the healthcare world?
Right. So people come to me and ask me what I think is going to happen, especially related to healthcare in the future. So it's a little bit of a strange job. I started my career in public health, and so that was, when I was young and in grad school, and that was sort of my first job was in public health in Massachusetts. And over the years have sort of just built up this both reservoir of information, but also I think the ability to sort of, what my clients say is see around corners. So sort of guess with okay degree of accuracy what's likely to happen in the future. So people come to me, whether it's a patient group or it could be a state or it could be a Fortune 100 company, and they say, tell us what you think will happen in healthcare in the next year, in the next 5 years. Go ahead. Do my best to answer those questions.
Great. Like you said, that forward-thinking sort of trying to predict what might come based on what's happened before and who you're talking to. Over time, especially as you've been doing this consulting for the past 13 years or so, how have you seen healthcare change? Obviously, everyone's seen healthcare change, but as somebody who's trying to see ahead, see the trends, what have you seen change?
Obviously, it's a lot more expensive. I mean, that is one of the major changes, and I've only started my company since 2005, but, even sort of going back before that, the costs have really gone up significantly. And so I think now you have sort of everybody in the system concerned where, if you were looking at this 20 years ago, maybe policymakers were concerned or, a certain sort of patient was concerned. So again, before even in the recent past, if you had a pre-existing condition, you were very concerned about healthcare costs. Your costs have been expensive for a long time. But if you didn't have that, maybe your costs weren't so high. Now, pretty much everybody's concerned about that.
Yeah, absolutely. And that was one thing that I remember discussing quite a bit at the panel was the difference between cost and price. And you made a good point that for a lot of people, cost, there's only a handful of folks who are really, really concerned with the cost of care because they're constantly they're constantly having to be at the hospital. They're constantly seeking treatment because they have some kind of something that requires regular treatment. The rest of us, not as much. We're worried about the price because we're worried about what happens if I break my leg or what happens if I need a new prescription medication or something. About what percentage of people are really, really constantly seeing the doctor, going to the hospital, and what percentage are, like myself, where I'm only there in the case of an emergency almost?
Well, one way to look at it is 50% of healthcare costs are borne by only 5% of people. So then that number sort of, so then the next break is about 80% of costs are borne by 10% of people. So, the sickest among us, if you put 100 people in a room, only about, 5 to 10 of those people will be going to the doctor or specialist or, in and out of the hospital, every month. Only about 5 to 10 of those people.
Absolutely. Has that contributed to the rapidly rising cost of care, or are there other factors kind of at work?
Well, one thing that's notable about those numbers is that they have stayed surprisingly steady. So that really hasn't changed even in a generation. It's always been about 5% of the population driving about 50% of the cost. What has changed is the total cost then that's being spent on people is higher. And also the rest of us, sometimes they are called like the worried well. Sometimes the rest of us are now spending more money on healthcare than we did before. So there are a variety of reasons why that's the case. And I'll push it back to you to see sort of what direction you want to head.
Oh, yeah, absolutely. Well, and the next place I wanted to go to was, what issues right now are the healthcare consumers facing? What are some of those biggest ones that kind of factor into the rising costs and the rising price? What things are making people the most frustrated, or what do you find are just not working in the consumer's favor right now?
So one that you already sort of differentiated, but I want to do it again, which is we're really talking about a consumer. And of course, a patient is a consumer, but one of the first pushbacks you'll hear is, if you're on your way to the ER, you're not going to stop and look up the price of which ER is the cheapest. Or, if you are a cancer patient, it's unlikely that you're sort of shopping based on on the price of right? You're shopping based on quality, or maybe there's only 3, cancer docs in the whole country that can treat so let's talk about just a consumer. So your example from before, you broke your arm or you have bronchitis, something like that. I think the number one complaint that I hear from people is that they don't know what things cost. So, and we're mixing and matching here the words cost and price. Obviously, cost is what it costs the, provider or the company to produce the service or the good. That's like saying, how much does it cost Apple to make an iPhone? That's different than the price the consumer pays. So I'm going to start switching back to price, which is what's the price of, for instance, if I am of the age that I need to go get a mammogram. So what is the price of that mammogram when I go to get it? In Colorado, actually, they've done a lot of work to try to make those prices more available to people. But, we're not programmed to do that. So that's one thing that's really changed in the past 15 years even is to think about, what price is gas on this corner or that corner? We might think about that. We don't really think where should I go get this service, healthcare service? Where's the cheapest place for me to get, my bronchitis medicine? So we need to be thinking that way and more aggressive about sort of checking prices and asking more questions about what's the price to me for this particular service.
Absolutely. And like you said, it's kind of a good metaphor. You wouldn't go to the gas station that's seemingly gouging you for 20 cents more than the one that's 2 blocks up the street because it's supposedly the same gas. You hope it's supposedly the same treatment, or especially when it comes to something like just getting an x-ray or getting a mammogram. Hopefully it is the same treatment, but the price is so wildly different. And the cost apparently is something that, like you said, a lot of it can be difficult to track down exactly what it costs the hospital or whoever to provide that service. Mm-hmm. And along with, that difference, like you said, that's a great piece of advice for consumers, for patients, for anybody who's in the healthcare system right now. Ask questions, know where you're going, know what find those, avenues. What are some places that you can look to get good, reliable information about cost and price of healthcare?
So again, Colorado is really a leader in this space as a state, and you can go online and you can look up all kinds of price information, whether it's certain kinds of hospital visits. You could find out, what it costs to get a hip replacement, like we just talked about, like sort of preventive scans, an MRI, a CT scan. You can also look up information about your prescription drug price. So if you just Google, Colorado healthcare costs or Colorado, I think that's the best place, health prices, it should send you to this website where you can, plug in some information and it'll tell you by zip code. So I did it as a test this morning, actually.
Okay.
It'll tell you by zip, you can plug in your zip code and what you need. Now, not every single procedure or service you could ever receive is in the database, of course, but it at least gives you a sense. And then to your point about driving for gas, you might decide wow, this particular service is hundreds of dollars cheaper if I'm willing to get in my car and drive for 20, 25 miles. I'm going to do it. You might decide the opposite, like, oh, it's only $50 different. I don't have time to drive 25 miles. I'm not going to do it.
Yeah, and I think, that is definitely one thing that a lot of locals who live here in Summit County run into is that more often than not, that's what it comes down to is like, I am going to have to leave the county, or I am going to go someplace else. And that's a whole other issue is that, it seems like healthcare providers are wanting to bring different services to the mountains, to some of these rural areas where healthcare costs are so high. And it seems like even though the costs are so high, we're just not getting the same amount and level. Is that something that you see changing anytime soon, especially in Colorado as rural areas begin to be more populated, and especially Summit County is just kind of a hotbed of migration from other states right now? Do you see more services, more opportunities coming to areas like this?
I think that they could. I, again, would really say the consumer has the ability, just like we do in other parts of, other marketplaces, to really drive demand. And so I think it's quite clear to people that the costs in Summit County are higher than they are in the rest of the state on average. But sort of pushing for choices is probably the next thing that Summit County residents need to do. So, for instance, you have direct primary care in Summit County, and it is a cheaper way to get at least access to primary care. It doesn't help a lot with your insurance costs. So that's, it gives you a little bit of relief, but not a lot. Pushing for telehealth and sort of saying, no, I would like to access the cheaper physician that might be in a different part of the state, but I don't want to have to leave Summit County. So I'd like to have, a telehealth option. Something like that is something you could push for. Retail clinics. So in the rest of Colorado, there are places that you can go into, like a CVS Health or a City Market or a Target, something like that. And there's a retail clinic, and they don't seem to have any in Summit County. I wasn't really sure why that was the case, but it's the kind of thing that you could say, why can't I just go into, my Walmart where I can get to it, it's open late, and again, get an exam because I think I have bronchitis or something relatively simple.
Interesting, because I, again, living up in the mountains for as long as I have, I guess I didn't realize that was even an option, because when I lived in Eagle County area, didn't seem like that was around. And yeah, like you're saying, Summit County, I can't think of anywhere that offers something like that.
Yeah, they have them in the rest of the state, right? So that's a perfect example of like, well, what's happening there? Call your legislator, go to your local Walmart and say, why don't you have a retail clinic here? Like, I'd really like to use one. I don't know the answers exactly, but I can say that we can push both as consumers and as constituents to try to generate change.
Yeah, and I think that comes down to the main point is that first, get yourself educated. Like you said, go online, search what it is that you're interested in, and then speak up about it. It's politics in action, right? It's the political system in action. But you got to make the time for it, and I think it's another thing that, especially if somebody is worried about their health anyway, or, they've got a health issue, maybe fighting for their rights. Have you found that, if somebody is worried about their health in the first place, that fighting for their rights or fighting for different, management costs, whatever, kind of takes, a second stage?
It does, and I think especially, again, if you do have a chronic illness or, you have a serious debilitating illness, obviously you're spending most of your time and energy, and your family might be as well, sort of fighting that. And the fact that you have to then fight the system as well is exhausting, to say the least, frustrating and unreasonable. But I think even as consumers, we don't even realize that there are other options available to us. And so just that fight. And again, I know a lot of people just think, I just want to go in and do this thing, right? I just want to go in and pick up my prescription or, I just want it to work. And I think that's exactly right. You don't want to pick up your phone and have it constantly not work. You want it to do what you want it to do. But we demand those things, and so phones get better and better. Similarly, right? We have to go in and be a lot more demanding and say, this isn't working for me. I think this system is terrible, and I'd like it to be better in this, these specific ways. I want you to be open later, right? I want more convenient times. I don't want to have to book 3 months in advance. Whatever your particular issue is.
Definitely. And that kind of brings me to the last piece was, we talked about what patients and consumers are facing right now. How about policymakers? What are some of the big sticking points that policymakers are battling, whether in Colorado or even across the nation when looking at the federal health care?
I would say I don't often sort of side with a policymaker and sort of say, well, you have to think about it from their point of view. But and the issue of healthcare, it's important to remember that most people get their health care either through their employer, and most of those people then are sort of exempt from most state laws. It's complicated, but basically they, only the feds kind of weigh in, or they get their care from some kind of government system, right? The VA, or they get their care through Medicare or through Medicaid. So there's really only a small fraction of any population. So in Colorado, it's less than 10% of the overall market where your state legislators really can do very much about your health insurance costs. That's really frustrating for everyone involved, right? Because if you go in and you're complaining about, the cost of your prescription medicine, it's highly likely that that is out of the hands of the state lawmaker. So I think that is one of the hardest parts. And as a healthcare futurist, I would say this is something that probably is going to need to sort of shake loose, if you will, that the way we're sort of pooling lives and the way that we're thinking about the system is not likely to hold, because now costs are just too high. And you've got both people that don't have any access to care, and then a lot of people that are sort of saying, well, my system works fine. I get it through my employer and everything's okay. The lawmakers are getting really frustrated because there's so little they can do. And we need to probably figure out a way that they can force insurers and providers to be behaving differently.
Okay, yeah, and that kind of comes back to the big issues. I remember from the panel that they did a survey of a lot of females in Colorado, because females tend to make the vast majority of healthcare decisions, at least in Colorado. And one of the big things was them saying that the system's broken, the system doesn't work, that the federal government doesn't care about whether or not the system works. It's there and it's broken. Where do you see things heading in 5 years? What is a possible solution for such a large group of people in the U.S., for 360 million some odd people? What's a solution that seems viable for healthcare?
I think something that is viable, again, in a state like Colorado, politics are different. It's a big country, and every state, sort of sees this puzzle a little bit differently. Colorado's already done quite a lot to try to fix some of these issues, but if you could figure out a way that if somebody shows up and says, I want to pay a health premium, I want to pay into the system, but the prices that are being given to me are too high, I'm not asking for a government subsidy. I'm just saying I'd like to pay in, but maybe a little bit less. It feels like you could imagine some sort of way that a state could accommodate that. So it could be through what used to be called high-risk pools. It could be through some new sort of state-only health insurance that's not Medicaid, so you're not getting money from the government, but the government's helping you negotiate. Association health plans, which are coming on the scene again. There has to be a way that people that want to pay. You have a full-time job at Walmart. Walmart doesn't offer you health insurance. You want to pay something toward a premium, but you can't afford what's being offered. We really need to bring people in that are willing to pay and give them a service that they are looking for. Okay,
so almost a solution where we will take what you can pay instead of giving handouts and trying to figure out some very complex, vast system of who pays more and who doesn't and who's free and who's not. It just maybe a little bit more. It almost seems like that could be a little bit of an equalizer too. Not equalizing as in the dollar amount, but equalizing as in everybody is paying to the system instead of feeling as though some people are paying more than they should or more than their fair amount.
Mm-hmm.
Great. And then finally, we talked about it a little bit more. What can be done right now to lower healthcare costs? Any other pieces of advice for consumers or patients? What they can do right now, this minute, if they're heading to the doctor, to really watch out for their costs and protect their wallet at the same time?
Yeah, absolutely. Ask your doctor, your specialist, your pharmacist, what will this, what's the price of this to me today with my insurance? What's the price without my insurance? So you would be surprised, and Colorado is one of the handful of states that passed the law, for instance, that now pharmacies can answer that question. They were not allowed to ansir it until January of this year.
Okay. Huh.
Not by law, but by contract.
Gotcha.
So pharmacies would sign, something that said, like, well, I'm sorry, but I can't tell you. So the lawmakers have stepped in there and said, no, you can't have those kind of contracts anymore. So that's the number one thing I would say is when you're in there at the point of care, we call it. So when you're there with your healthcare professional, ask the question. And if they don't know, see if they can find out. Say, like, look, I understand maybe I'm only in here for 5-10 minutes, but could you have your billing office check or something? Do I have any choices? Is there a cheaper way to do this? Is there anything I can do to lower my price while we sit here together? And I think at the panel you heard stories. I hear them all the time where somebody says, oh, yeah, I asked, and, it was 50% cheaper if I paid at the point of care. Now, I appreciate not everybody can do that. So, the doctor saying, oh, well, this will only cost, the scan will be only $500 if you don't use your insurance. Yeah. Not everybody can just sort of say, oh, well, here's $500. But at least you can know the answer and then decide for yourself at that time, what choice you'd like to make.
Absolutely. And like you said, again, it comes down to just asking the right questions when you're there, not after you're done, not after the bill has been sent.
Right.
Because I imagine, especially with healthcare, that it's much more difficult to get something retroactively done than it is to be proactive about it. Like all things in life.
Absolutely.
Great. Well, Brenda, that was the final thing I had for you. Anything else you can think of that folks in Colorado should really know about healthcare?
You are some of the healthiest people in the country. Let's keep it that way. So you're doing something right. It's easy to focus on, what isn't going right, but I grew up in Colorado. I was born there, and I'm always proud to be a Coloradan and say, we're active. We get out there. We enjoy, everything that's available to us, and that is lowering our healthcare costs down the line. We're healthier. We live longer. So we'll put a positive spin on it too, which is we're doing a lot of things right in Colorado, and so focus on the positive.
Absolutely. Focus on the positive, and maybe that might even add to your better health over time, too. Positive thinking.
Right.
Brenda, well, thank you again for making time to talk real quick about healthcare. Appreciate your insight and the advice that you had for everybody and anybody here in Summit.
Thank you, Phil.
Thank you much. On Krystal 93.